and local capacity is limited. Finally, there are no human vaccines available for any vector-borne disease found in the U.S. So we are committed to making strategic investments in promising new prevention strategies, including informing and supporting vaccine development and implementation as vaccines become available. Thank you again for the opportunity to appear before you today and for your support of the threat of vector-borne diseases. I'm happy to answer any questions that you may have.
Thank you, Dr. Peterson. Dr. Dill.
Well, good morning, everyone, and welcome to the University of Maine, and thank you especially to Senator Collins for the opportunity to speak before the Special Committee on Aging in regard to the increasing challenges associated with combating tick-borne disease here in Maine. As the pest management specialist for the University of Maine Cooperative Extension and a state senator in the Maine legislature, I have had the unique opportunity to experience these challenges from both the political and scientific perspectives, but today I will speak from my university perspective. Tick populations have undergone extensive range expansion over the past 50 years, particularly here in the Northeast. Multiple factors, including reforestation, changes in climate, and increased abundance of wildlife hosts such as rodents and white-tailed deer have contributed to this surge. Maine is a heavily forested state with a largely rural population that spans 4 degrees of latitude. Tick-borne diseases identified in the United States, 5 have been found in Maine, including Lyme disease, anaplasmosis, babesiosis, Borrelia miyamotoi disease, and Powassan encephalitis. The primary vector of these pathogens, the deer tick or black-legged tick, has greatly increased in both population size and geographic range within the state. Furthermore, Maine faces significant threats related to invasive tick species, including the Lone Star tick and, as just mentioned, the Asian longhorn tick, both of which can have serious impacts on the health of humans, wildlife, and domestic animals. Combating these threats is an immense challenge that relies heavily on an integrated approach that includes investment in new medical treatments, tick and host habitat, managing ticks and their wildlife hosts, and widespread educational outreach. Maine has been fortunate to have a relatively long history of research and outreach on tick-related issues, thanks to a collaborative network of private and public institutions. The Maine Medical Center Research Institute has been conducting research on ticks and vector-borne disease since the late 1980s and has emerged as a leader in the field. Maine CDC has taken a proactive role combining epidemiology with widespread public outreach efforts to help minimize the spread of tick-borne diseases. Many states have stopped counting cases of Lyme disease due to the high burden placed on, instead estimating their cases. These estimates can vary in accuracy, thus affecting the regional and national rates of disease. Maine CDC is still counting individual cases, but as the burden continues to increase and funding remains limited, a transition to an estimated system also might be likely. At the University of Maine, significant research is underway both in the School of Biology and Cooperative Extension. A primary goal of UMaine Extension is to explore ways to minimize the occurrence, spread of ticks and tick-borne disease in Maine. Understanding the shifts in tick population size and geographic range is critical in evaluating and targeting management strategies. UMaine Extension currently monitors tick populations through a public tick identification program and tick-borne disease screening program. Through these programs, Maine residents can send tick samples to the lab for identification and test whether ticks are carrying the pathogens that cause Lyme disease, anaplasmosis, and babesiosis. Additional pathogens are scheduled to be added to the testing program in 2020. A small-scale active surveillance program is also ongoing in which ticks are actively monitored through field survey. Animal hosts is also ongoing. The information generated from these programs will allow us to track the distribution of ticks and tick-borne disease in Maine and to identify priority areas for targeting prevention and management strategies. The University of Maine School of Biology and Ecology is currently investigating multiple avenues related to the ecology of tick-borne disease, including the environmental conditions that enhance disease transmission, the impacts of climate change, and human land use patterns on ticks, as well as the risks related to tick-borne disease in Acadia National Park and its potential effects on the tourism industry. The public demands and political will to fight Lyme disease and other tick-borne diseases are strong in Maine. However, as with many rural states, the funding to wage such a battle is limited. Nonetheless, the people of Maine prioritized this battle in 2014 when voters approved a bond referendum to create the new University of Maine Cooperative Extension Diagnostic and Research Laboratory. Following several years of intense planning and construction, the new lab opened in June of 2018. This high containment facility brings together research on animals, plants, and arthropods within one biosecure setting, and has greatly enhanced the university's diagnostic capabilities. The construction of this facility has also broadened the university's collaborative efforts, facilitating collaborations between UMaine, Maine CDC, and the Maine Medical Center. Through the work being done at UMaine Extension, the University of Maine School of Biology, Ecology, Maine Medical Center, and the Maine CDC, the state has a solid infrastructure in which to tackle the issues surrounding tick-borne disease. Historically, however, funding for tick-related research, and particularly outreach and education, has been a relatively low priority. The Tick Act will inject a much-needed investment into research and education and allow us to leverage existing infrastructure to fund novel approaches to monitoring and managing ticks and tick-borne disease. Thank you again, Senator Collins, for the opportunity to speak today, and I welcome any questions.
Thank you very much. Dr. McCloy.
Thank you, Senator Collins, as well as to the esteemed members of this panel, and especially to Paula Jackson-Jones for setting the temperature controls and getting us all ready for winter. Illness has been as intellectually challenging to properly diagnose and manage as Lyme. The more I learn about this disease, the more questions I have, and the more I realize we have just scratched the surface of how complex the answers are. Hopefully your work on the Tick Act will move the research forward and provide more hope and more help to Mainers and to the worldwide public health. As a young resident at Maine Medical Center, I felt I was well trained in the classic signs and symptoms of Lyme disease. We were taught to look for the bullseye rash, the flu symptoms outside of flu season, the joint pain. Like my colleagues, I treated these acute cases with a short course of antibiotics. However, I began to see more and more patients that didn't fit the typical scenario. They never remembered a tick bite. They never had a rash. Their blood testing was negative for tick-borne illness. But they grew sicker and sicker despite seeing multiple specialists. I had to become a detective doctor to figure out how to help these people. I needed new tools for my toolbox. I began attending conferences run by the International Lyme and Associated Diseases Society, or ILADS, and learned that there was more to the story than the basic model I was taught in medical school. I learned that there were differing opinions and conflicting guidelines between the Infectious Diseases Society of America, or IDSA, and ILADS. In short, IDSA states that Lyme disease is easily diagnosed with standard two-step blood testing and easily treated with a short course of antibiotics. If patients' symptoms persist, it is because of the damage already done and not because of a lingering infection. ILAD's view is just the opposite. The standard testing may not be accurate because of how Lyme can fool the immune system, and a short course of antibiotics may not be enough to eradicate all organisms in a person's body. ILADS feels that chronically ill individuals need a more comprehensive and long-term therapeutic regimen to treat their real disease and not just be dismissed as suffering from the aches and pains of daily living. Here we had two groups of very smart doctors, both wanting to help their patients at loggerheads how to diagnose and treat Lyme disease. This conflict left me and my patients in the middle, searching for solutions. Now, I've got a master's in public health and a master's in medical sciences, so I love research. I dove into the literature from the standpoint of an open-minded skeptic. I read both sets of guidelines. I read the peer-reviewed journal articles supporting both sets of guidelines. I looked into who the authors were and who was paying for their research. In the end, I tried both sets of guidelines on my real-life patients to observe which approach works best. I found there was room for both the IDSA and ILADS solutions, depending on the situation. The IDSA approach works well for has a strong, healthy immune system at baseline. Then the testing should begin to turn positive after 2 to 3 weeks of infection. Fortunately, this infection is usually very easy to treat with a short course of antibiotics if you catch it early. Unfortunately, if you don't catch it early, this smart little spirochete begins to go through its own life cycle. It changes its shape and hides from the immune system, causing inaccurate false negative blood testing. It creates a physical barrier called a biofilm that protects it from antimicrobials and from your own white blood cells. We are discovering months or years before they wake up again. In the unfortunate individuals who become chronically There's a complex interplay of genetic factors, inflammation and immune dysregulation, hormonal imbalance, neuroendocrine disruption, and neuroinflammation, leading to cognitive deficits and psychological illness, gastrointestinal dysfunction causing nutritional insufficiencies, which create metabolic imbalance, and poor mitochondrial function, leading to the chronic fatigue that many describe. So lots of big words there. As I learned, a few weeks of antibiotics are not enough to heal these complex cases. The ILADS approach works better for these types of patients. It is an individualized, head-to-toe, integrative method of figuring out what is broken, what are the root causes of the illness, and how to help that person heal from the inside. That have their own risk of side effects. It's complicated and it takes a lot of the practitioner detective work. It also takes a lot of the patient's time and energy and healthcare dollars to walk that road to recovery. These people need a lot of support to get them through the bad days. Eventually, they celebrate more and more good days and move forward to remission. To summarize, I have learned that there is no perfect set of guidelines, no one-size-fits-all algorithm that works for every case in the real world. The testing is imperfect. The medications don't always work. Some people get better right away, and some people develop problems that linger for years. The classic presentation of Lyme disease that physicians learn about in medical textbooks doesn't always apply because the little bug forgot to read the textbook. We need more answers, Senator Collins. How can we prevent the illness in the first place? How can we improve the accuracy of the testing? How can we tell which treatments work best? And how do we know when to discontinue a regimen? Your excellent work with the Tick Act
Ms. Jackson-Jones.
Chairman Collins, thank you for holding this hearing and for inviting me to testify today. My name is Paula Jackson-Jones, and I'm here to share with you my personal story and my life's work. This has been a 10-year crusade for me, with the first 5 years fighting for my life and the later fighting on behalf of others. I was bitten by a tick in October of 2009 while outside doing fall cleanup with my husband. At the end of the day, I discovered a tick embedded in my side. We removed it, flushed it, and didn't give it another thought, not even when I became symptomatic 10 days later. For the next 2 years, I was misdiagnosed by 23 doctors and specialists with everything from panic attacks to respiratory infections, chronic fatigue to fibromyalgia. When my neurological symptoms intensified, a scan revealed lesions on my brain, and I was diagnosed with MS. When my symptoms became even more severe and I was not responding to treatment, I was reevaluated, and my diagnosis was changed to Parkinson's. I was 36 years old. When I began to have trouble swallowing and the use of my arms and legs, my medical providers wanted me tested for ALS. I knew that was a death sentence for me, and it was at this point that I knew I needed to fight and advocate for myself. Thanks to a family member who kept pressing me to be checked for Lyme disease, even though I had 4 negative tests, I demanded to see a provider who knew about Lyme. However, the intern gave me a scrap of paper with the name of someone he knew who saw Lyme patients. And in April of 2011, after clinical examination, additional blood work, and tests, I was officially diagnosed with late-stage neurological Lyme, complicated by Babesia, Bartonella, Rocky Mountain spotted fever, and ehrlichiosis. I was CDC positive for all of these tick-borne diseases. That Maine doctor, the 24th medical provider that I met with, not only saved my life, but gave my life back to me. When a cancer doctor thinks outside the box and heals their patient, they are deemed a hero. When a Lyme provider does it, they are brought up under medical scrutiny and disciplined beyond belief. My treatment was not conventional or mainstream, but it was effective. It was tailored to my infections and to how I was responding every step of the way. Thankfully, my medical provider had a vast amount of resources to turn to when treatment options failed, which they did, and I'm so grateful for my health today. In April of 2014, after going into remission, I wanted to make a difference by raising awareness about the risk of tick-borne disease, educating people on how to protect themselves. Lyme disease support and education to connect patients and their families with the services that they need to journey back towards health and wellness. We are a nonprofit 501c3 organization that travels statewide, raising awareness, fostering education, advocating for change, and providing support to those in Maine afflicted by tick-borne disease by linking them with medical providers, educational programs, and financial assistance. We are also the main partner of the National Lyme Disease Association, members of Maine CDC Vector-Borne Work Group, and active in Maine's Lyme legislation movement. In 2018, I served as the co-chair to the Federal Health and Human Services Tick-Borne Disease Working Group's task was to identify gaps and barriers that patients faced in accessing proper diagnosis and treatment. That information went into a report and was presented to Congress. I was very honored to have been selected for that role. Tick-borne disease is not a cookie-cutter disease, which explains why the cookie-cutter approach has failed time and time again. Today, each of us on this panel has highlighted the increasing incidence of tick-borne disease infections and even viruses, which could cause serious illness and death. Excuse me. The actual numbers are likely much higher, since experts agree that the public health burden of tick-borne disease is considerably underreported. That's why it's so imperative that we adopt an all-hands-on-deck public health approach. We need to build a robust understanding fix faulty tests and increase physician education. Enacting the Tick Act that Senator Collins introduced will provide a lifeline, not only to patients, but to medical providers. With funding available for research and education, we can get medical providers on the same page, not only with improved diagnostic tools, but better, more effective treatment options for their patients. With the Tick Act, we can stem the growing threat of tick-borne disease. Thank you again for this opportunity, and I look forward to your questions.
Thank you so much for your moving testimony and sharing your personal odyssey with us and all the good work you've done for others as well.
Thank you.
Mr. Philbrook.
Thank you, Senator.
Chris.
So it's a small thing, but I didn't realize how important smiling was to my mental health until I couldn't do it anymore. On a Saturday afternoon in 2007, I took a trip to Hogback Mountain in Virginia. Shortly after that trip, I woke up incapacitated. I could barely move a muscle. I thought it might be the flu, so I stayed in bed and didn't think much of it. I've always been healthy and quick to recover, so when my condition didn't improve in a few days, I flew back to the great state of Maine to see my doctor. One problem with Lyme disease is that the symptoms mimic so many other things, as I would soon discover, and Paula just mentioned in her testimony. When I got home, my 7th cranial nerve, which runs down the left side of my face, and you can still see, went into a state of trauma. In addition to flu-like symptoms, I now also had Bell's palsy. I also couldn't eat or sleep for days, and was in a state of pain so debilitating that I went to the emergency room and received a CAT scan. The scan showed nothing abnormal, so the doctor suggested I see a neurologist. I also scheduled a dentist appointment to see if something was wrong with my teeth because they hurt badly. The dentist took one look at me and said, "Bell's palsy can be the result of Lyme disease. Do you have a tick bite or a bullseye rash?" I didn't. But I mentioned this to my neurologist and he tested me for Lyme. The test came back negative, a false negative, which is something Dr. McCloy just said in his testimony. Shortly after that, the right side of my face went into a state of paralysis. I now had Bell's palsy on both sides of my face, and my mouth was almost completely wired shut. So the neurologist recommended an MRI. The MRI showed what looked like a tumor, either growing or blocking my cavernous sinus, which is a nerve that runs from the brain to the face. We started talking about surgery and radiation. Now I'm starting to worry. Next, the neurologist recommended a spinal tap. If you've never had a spinal tap, consider yourself very lucky. It's awful. When the neurologist also ordered a second MRI, blue dye into my body so the tumor would show up in greater detail, he also ordered a chest x-ray because I was having trouble breathing. The spinal tap showed Lyme in my spinal fluid, and the blue dye showed that the disease had attacked the nerves in my brain, causing extreme inflammation. But the good news, I didn't have a tumor. I did, however, need a PICC line immediately installed. For 4 weeks, the line delivered a strong dose of antibiotics from my bicep to my heart. I was working on Senator Collins' staff at the time. She watched the pain and suffering firsthand. I still have daily notes from her checking in on me. One said, "You gave us quite a scare." It was scary. And remains scary today, knowing that even in my backyard there are ticks. With its proposed public-private partnerships, including pest control, the Tick Act aims to alleviate this threat, a prospect that would relieve a lot of anxiety for anybody who's gone through this. I was lucky my dentist spoke up, that I had a spinal tap, not a normal Lyme testing protocol, and that my Lyme disease was treated quickly within the first month and a half. I'm happy to say that after my antibiotic treatment, I was cleared of the disease, although the residual effects remain, mainly sleep disturbances and facial paralysis, which you might not notice in the audience, but I'm quite certain the cameras will pick it up, as I've seen on TV. Others are not so lucky. When Lyme is not diagnosed quickly, co-infections can develop, and the disease can become much more difficult to treat. This happens far too often, which is why the Tick Act's directive for improved diagnostic testing is so important to me. For my ongoing symptoms, the most effective relief has come from food. After 8 years without improvement, and having been told the only solution to improve my facial paralysis was plastic surgery, I started on the ketogenic diet and intermittent fasting, something author Tim Ferriss said was the only thing that knocked out his Lyme disease. Within 7 days, I felt movement in my face that I hadn't felt in years. Because ketosis, or nutritional ketosis, which I was trying to achieve, is unrealistic for me to maintain over the long term, I've fallen back on Tom Brady's eating and training measurement, the TB12 method. I figure if it's good for him, it's definitely good enough for me. While this approach may not work for everyone, it did work for me. The problem is my story doesn't scale. I heard this approach by chance on a podcast. Conversely, the Tick Act would create a database where the treatment approaches and outcomes could be shared immediately in the context where it matters the most, in the doctor's office. Thank you, Senator Collins, for this opportunity and for your work on this public health threat. I hope the Tick Act, when enacted, gives people currently suffering with Lyme disease validation and hope that they can and will get better. Thank you.
Thank you so much, Chris. I so remember when you got the result and how worried we were. And then when it turned out that it wasn't a tumor, still so worried because of the symptoms and pain you were experiencing. And I want to thank you for sharing your You told us how UMaine accepts tick submissions to identify the different types of ticks and whether or not they are carrying a pathogen. Could you give us some idea, since April 1st, when you first about how many ticks have you received from Mainers?
In that short period of
A little worried that this hearing is going to overwhelm the University of Maine. Can you give us an idea of approximately what percentage of them carried some sort of disease, and Lyme disease specifically?
Yeah, of the ones tested, which was about 11. Actually carried Lyme disease, and of course that is statewide. And just to carry that further, anaplasmosis was 8% and babesiosis was 6%.
So that's a substantial number. University trying to figure out the geographic distribution and whether there are hot spots in the state. I remember when Lyme disease didn't even exist in Maine, and then each year we've seen northward, but still there seems to be a difference in the geographic distribution.
Definitely a difference in the geographic distribution, especially as you go from south to north. It gets fewer and fewer. The coastal areas and southern Maine is really right now our hot spots. But what we're doing is with the surveillance that we're doing with the ticks being tested, we actually have some ongoing work, and we're working with Maine Medical Center, who's doing surveys also in I think all 16 counties, and we're testing the ticks for them. So it's a great collaborative effort we have in the state of Maine. So we're looking at this type of thing as we move forward, try to get some type of distribution.
Thank you. Dr. Peterson, in 1947, and no, I was not alive then, in 1947 we launched the National Malaria Eradication Project. And this federal program with state and local participation succeeded in eradicating malaria from the United States in a very short period of time. I think it was by 1951. And the anti-malarial campaign involved large-scale public health initiatives. Our approach to tick disease, tick-borne diseases and Lyme disease, is very fragmented today. And it really relies on the individual, people like Paula and like Chris, with their physicians to try to figure out what in the world is going on. So with the TIC-X national strategy, we're seeking to ultimately halt the progression of Lyme disease. That's an ambitious goal. Since you have so much experience with other epidemics and at the CDC, could you explain to us the difference that a larger scale public health approach at the federal, state, and local levels what promise that holds for Lyme disease control and prevention?
Yeah, thank you for the question. And with malaria, this is just going to continue to get worse and worse. Excuse me, in particular. Excuse me. So one of the advantages that they had with malaria was that there was DDT and other things that we may not want to use right now that could effectively control the mosquito vectors. Unfortunately, for Lyme disease and other tick-borne diseases, we don't have really good strategies, like a real unified strategy. We need to do better surveillance for the ticks to see where they are, as Dr. Dill has mentioned, as well as trying to figure out how to better diagnose patients, as several of the panel members have mentioned. So it's going to there's no simple, easy answer. Solutions for this growing problem.
I was struck in your testimony when you pointed out that there's no vaccine that is available for Lyme disease. And I was thinking about that because my husband and I got a dog 1.5 years ago, and we had her vaccinated for Lyme disease. So I know this isn't exactly under CDC's purview, but I'm sure you're a partner with the NIH and others. But what are the barriers to developing a vaccine? And is that an approach?
A very safe and effective vaccine for Lyme disease. I think ultimately this is going to be one of the key answers in trying to control Lyme disease. The key is it's got to be safe and it's got to be effective. And there's just reasons. And so there's a company called Valneva that is in stage 2 clinical trials with a Lyme disease vaccine, both in the U.S. and but it's still going to take several years to be able to bring this vaccine to market. So, bullet for this. It will certainly, if a safe and effective vaccine is produced, that's great, because we've got a huge increase in Lyme disease. But we have to remember that the same tick that spreads Lyme disease spreads diseases like anaplasmosis, Powassan, and so it's going to take both an effort and ways to find the right solutions for this.
I'm encouraged to know that there are some stage 2 clinical trials going on, though. That is encouraging. Ms. Jackson-Jones, treatment for Lyme disease can be very expensive. And you talked about, I think you said that you went to more than 20 doctors to try to get an accurate diagnosis. We've heard his dentist who fortunately made the link. So talk to me about how expensive it can be to get an accurate diagnosis and treatment.
Well, there's still support measures and support finances that you go through. There's damage control. All the different antibiotics that I took before finally getting the proper diagnosis. So I could almost double that number easily because I'm still taking support measures today to support my adrenal. And we all know if you eat healthy, it's not cheap either. So, just trying to stay healthy, stay with a healthy diet, exercise, reduce the stress. There's costs associated with all of that. And it's not.
On top of the disease. Dr. McCloy, you talked about the disagreements among medical professionals on what should be done. And we also have an issue where the to show up, and there's this 2-stage blood test. So not to personalize this, but when I had a tick recently, my doctor didn't do the testing. She immediately gave me 2 doses of doxycycline. And so wouldn't it make more sense to start treating even if you haven't gotten the test result?
Well, but not all physicians would agree with that. I've been surprised at this sort of war going on out there in the medical world, in the medical community, and personal attacks between physicians over this whole Lyme disease question. If you've got a person with a tick bite, do you treat them right away? Do you wait till the results come back? Do you wait until symptoms develop? If it's a pediatric patient, what do you do with a very small child? We have to remember the antibiotics themselves have a lot of side effects and potential damage too, so it's always a risk-benefit discussion with each individual patient. For me, because I've seen the damage done,
Dr. P, efforts underway to try to improve the testing process?
Absolutely. I think as the nation's prevention agency, we would say the best treatment for all these diseases is to prevent them in the first place. However, you've had our other panelists as well as people in the audience have made it quite clear that the burden of disease is quite high, and I think the first step in treatment is to do proper diagnosis and get better diagnostic tests, and these are sorely needed, as was mentioned by several of the other panel members. And so we are engaged in a number of efforts to try and improve diagnosis. It's a huge effort on our part. We're working with other federal agencies such as the NIH, private companies, and academic.
Mr. Philbrook, I know you like me to call you Mr. Philbrook. One of the aspects of your terrible journey with this disease that so impressed me is you just kept trying to figure out what was wrong. And Paula did also. You didn't give up. And you also maintained this unbelievably positive attitude, which is really inspiring. Looking back at your own battle against Lyme disease, what advice would you give to an individual?
Her testimony, I think you need to be your own advocate right from for other people, because there is often an individualized approach to treating Lyme disease. I think, and I also would just say to take it very seriously and give yourself the time to get better. I mean, it's attacking your nervous system, so you really need to take that.
And if your family's been outside, do you check yourself when you come back in? Or what do you do on the prevention side?
Sure. We do a few basic things, like tucking your pants into your socks is an easy way to help prevent ticks from entering your body. The most important thing we've done, honestly, is a very simple step, which is take a shower as soon as we get back inside, whether it's hiking, preventative step we've taken. I'm obviously watching much more carefully my daughter than probably most people, but you check behind the ears, you check in the hair. Vivian Lee, who's in the audience, did a great service to Mainers and kind of went through a lot of different ways people prevent Lyme disease and different treatment options as well.
Thank you.
May I add
Yes,
something,
Dr.
Senator Collins?
McCoy.
One thing I
please.
try to educate my patients about is that daily tick check, really 365 days a year, and making it part of your just daily personal hygiene. So you brush your teeth at night, you do a tick check. And what I tell my patients is you're trying to find a poppy seed on your body. That's how big some of these ticks are. So find the poppy seed, check your partner, make it fun, check your kids. So that's part of your daily routine.
Thank you. That's good advice. Ms. Jackson-Jones, you talked about the work that you have done. Could you tell us a little bit? I know you put on an annual conference, and explain a little bit about that conference and what its purpose is and what your goals are with your organization on the Mid-Coast.
It's important to us to get resources to people and to introduce them to what all their options are. So every year in the spring, we hold an annual the Augusta Civic Center because we grew so fast. We bring in doctors, labs, businesses that come in, anybody that has a connection to Lyme and tick-borne disease. We have Dr. Dill comes in and he shares what the labs are doing. It's important to us to bring the speakers in themselves, to bring the researchers in to talk about the latest diagnostics. The labs will share what their latest tests are available. So that's good not only for the patients but for the doctors to know what resources are available. So the speakers get a chance to present what's new in the form of diagnostic, testing, treatment, support. And then we have anywhere from 100 to 125 exhibitors there where people can go up and actually network for free and get firsthand one-on-one offers. Talk to them. They have all their information there. You can talk to them, set something up. You can talk to the different labs, find out what testing is going on. You can talk to the different treatment companies are there and ask, what's new? What are you doing to combat Babesia symptoms? And then talk to other people that are there encouraging exercise and food and stress reduction. More importantly, we do it all for free. Wow. It does not cost anything to walk through those doors. We get federal grants, we get state grants, we get a lot of donations. We do charge our exhibitors for gas just to show up to get connected to resources. We want to make sure that that happens.
That makes a great deal of sense, and I know your conference is extremely valuable in educating people. Dr. McCloy, it sounds to me, when we listen to Paula and Chris's experience, that there's not a one-size-fits-all approach to tick.
Systems of their body it's affecting, and that's why it's called the great mimicker these days. It mimics a lot of other illnesses out there. The diagnosis is quite challenging too. A lot of physicians go with what's called a clinical diagnosis, meaning that if this person presents with a good story, if they've been in a Lyme endemic area, they're outdoors, that you need to rule out the other diseases that can cause those same symptoms. But if they've got 36 out of the 38 symptoms of Lyme disease, they probably have Lyme disease. But you still have to do your due diligence as a physician and rule out the lupus and the autoimmune conditions and the fibromyalgia and all these other things that could present similarly. So it takes a lot of time. It's quite challenging to do that as a physician. I think that's one of the limitations in our kind of conventional medical care system, where the physician might have 7 to 11 minutes with a patient per visit. It's hard to figure it out in that amount of time given.
I would think that it would be. Dr. Dill, if the TIC Act were to become law, which I'm determined that it will, how would it be helpful to you and the important work that you're doing at the university?
Diseases associated with them, and even if you just take Lyme disease, there's several different strains than others. So some of the things that would help with us is that I think that even though the state has been really good to us, as you can see looking at this facility, and in other ways, funding still hasn't kept up with anywhere near what it needs to be with education and management strategy, surveillance, and as we were talking as we walked through here, we could probably hire 25 people just in the tick lab in the state of Maine and not make a dent in all the research and that type of thing that needs to be done. So it would the community here at the university, the Maine Medical Center, the CDC, we all work together, and it would be a great boost to all of us.
Thank you. Dr. Peterson, the TIC Act would also reauthorize the CDC's regional centers of expires next year at the end of the fiscal year. So I want to make sure that doesn't happen, and that's part of the TIC Act as well. Could you share for us how these centers have it?
Excellence is a new concept that we had as following the Zika virus epidemic. And the idea was to try and merge academic institutions with state and local health departments and develop communities of practice in their areas among multiple states, as well as trying to train the next generation of medical entomologists like Dr. Dill, which he can testify to the fact used to be in the 40s in entomology. Now, when the Zika virus epidemic happened, out of our staff of 12,000 or so, we had 12 medical entomologists. So we need to rebuild this whole field. One was just to do the tick surveillance, for example. That not only do we want to do more in Maine, but we want to do more around the whole country and develop a true national tick surveillance network in all the states. Another thing that we're doing here with the Northeast Center of Excellence, for example, is working on this new Asian longhorn tick, trying to figure out what diseases it spreads, where it is, how it infests animals, how it infests people. And so that's been a very important part. We're also working with the Center So at CDC, we have a certain capacity, we have a certain staff, but by incorporating all these centers of excellence around the country has enabled all of our efforts to expand with
Would any of our witnesses like to add anything before we close the hearing. Is there any issue that you want to make sure is on the record that I didn't touch on through questions or testimony? Paula?
I think the one thing that most patients can agree on is if we miss the window, the early window of opportunity where our infection moves from acute to chronic, there's no instructions. Everything that has ever been written, including an ICD-10 code for insurance, that's all been written for acute. So that's one of the biggest hurdles is, once you outgrow that window and you move into stage 2, stage 3, stage 4, there are no instructions for doctors. And that acute box says you only get 2 weeks of treatment. And they're trying to be creative and think outside the box and think, what can we call this so that the insurances will cover it? If the doctors can't even give it a name, how can they treat it? So I would like to see, and that's something that I would like to see. We need to give it, and then we need to agree on how we're going to approach it for treatment. But as Dr. Dill, and
I know that.
and Dr. Peterson both alluded. I mean, even like with the vaccine, with a treatment plan, it's only going to go after one thing. If you have 2 or 3 co-infections, things start to get a little muddy. So I think having treatment options is the answer, and stop making it so cookie cutter. If we have to give it a cookie cutter name, then we give it an ICD-10 code, and we let the doctors go from there and treat their patients.
Very good points. Thank you. Dr. Dill.
I would just add that when we were talking about the statistics on the amount of Lyme disease, individual tick, and you may be looking at one disease and you actually have 2 or 3. So it's crucial all the way around.
Thank you.
Try and figure out how to better control these ticks. But in the meantime, I think it's very important that people protect themselves against tick bites by wearing permethrin-treated the devastating effects of some of these tick-borne diseases, and the best way to prevent that is to prevent it. And so it's very important that state and local health departments, patient groups, to try and spread the word about how people can actually prevent tick bites. And I know that I've met with the Maine CDC yesterday. They're doing an outstanding job on trying to educate the public on how to do it. It's not so easy. These ticks are very small, but people need to remain vigilant, and we keep
disease on patients and 4 weeks or so of antibiotics, and we have to help them navigate appeals processes, et cetera. Some states have passed legislation mandating the insurance companies to cover for longer-term treatment, but it's been a little piecemeal. So again, as part of a national effort, it would be nice to see some sort of legislative effort to mandate insurance companies to cover not only longer-term antibiotics, but also the other integrative therapies that Paula has discussed, all these various impacts on her body. you can't just throw 4 weeks of antibiotics at that kind of a situation. You have to treat it holistically and comprehensively, and that financial limitation is tough for patients. So having insurance coverage mandated would be a huge help for these patients.
Well, her 250,000 insurers haven't figured out that there are chronic cases and with diverse symptoms, and that it doesn't fit neatly into one insurance code for reimbursement. So those are both good points. Chris, we're going to allow you to finish up the testimony today.
Thank you. I hope this act just and it is generating the awareness for people to be thinking about this. Dr. Peterson mentioned prevention, and that's a key piece. But everybody in this room can be an advocate for themselves, can ask their friends that may be going through something like this if they've asked their doctor about Lyme disease. Just consider it as a
Thank you. I want to thank all of our witnesses today for sharing your stories, your expertise, and your insights. Your testimony green spotlight on the growing crisis of tick-borne illnesses and is a spur to action. We live in a state where we love being outside. It's part of our heritage in Maine, is to be outside, to go hunting, to do gardening, and we want to be able to continue to enjoy what makes Maine so special, and the great outdoors and the recreational opportunities it offers clearly are part of that. Attacking epidemic. Again, I will start where we began, and that is on a per capita basis. Maine has the highest incidence of Lyme disease in the nation. So we are particularly affected. And of those Mainers and of people nationwide who get tick-borne illnesses, those age 65 and older are at particular risk. Since Maine is the oldest state in the nation by median age, that adds to our vulnerability. Prevention remains so important, as we've just heard from Chris and other of our witnesses, being an advocate for yourself. But I also believe that we need to turn the corner and adopt a public health approach and make this a national priority. And collect data and share information, disseminate best practices, raise public awareness, educate healthcare professionals, work with the regional centers for excellence. I believe we can make a real difference. And I'm grateful for all of our panelists for adding to my knowledge as I continue to advocate in Washington for passage of the Tick Act. I think it truly would help us turn the corner and adopt a whole new public health approach to combating these tick-borne illnesses. So I want to thank all of you for being here today and helping us change the trajectory of tick-borne diseases. I also want to thank my staff, Sarah in particular, for her very hard work on this issue. She is a public health expert and has helped in developing this new approach that we're. Again, my thanks to the University of Maine, the Cooperation Extension Service, and the Tick Lab in particular for graciously hosting this event. I'm very proud of the work that's being done here at the university and hope that with the additional funding that would be available through the Tick Act that we can expand that work and give you even more resources. The lab may well increase, and that's a good thing, but I know you need the staff to handle it as well. The hearing record will remain open until Friday, September 13th, in case. But again, my great appreciation to all of you for being here today. You added immensely to our knowledge. And my thanks to all of you who have participated in so many ways. Scientific expertise in helping us draft the Tick Act. So I'm very grateful for that. And with that, this hearing is adjourned. It's official. Thank you.
Thank you. You too.